everyone. It's so great to have you join us today. I'm Erin Luganville, a community engagement manager with Church World Service. I'm based in Western Massachusetts, and we are delighted that you took a little time in your day to join us today to learn more about the impact of the funds that you're raising through the Crop Hunger Walk. And I am excited to introduce my colleague, Andrew Blakely. Um, Before I do that, just a couple of the things we always go over. The webinar is being recorded, and we will share that recording out with you in a few days following this webinar so that if you would like to share it with other committee members or walkers, you are welcome to do that. We really appreciate in advance when you registered for this webinar, we asked you for questions that you had for Andrew and our work in Ukraine and Moldova. Thank you. You all submitted such wonderful questions and meaningful questions, and we really appreciate having that feedback from you. And so that's helped shape the conversation that Andrew and I are going to have today. So thank you for that. If you have, as Andrew is speaking throughout, if you do have a follow-up question or a further question that something he said prompted, you are welcome to put that question in the Q&A box. And then at the end, we'll hopefully have some time to look through some of those and answer those as well. And thank you so much. I forgot to say, but you guys already know what to do. I'm glad to see you're using the chat to say hello and let us know where you're from. So feel free to continue to do that so that we can see or at least see all of the lovely people's names, even if we can't see your face. So at this point, I want to introduce Andrew. Andrew Blakely is based in Ukraine, and he, just a little bit about him, he's oversees our work in Ukraine and Moldova. And he served in the Army for 14 years, serving in combat and humanitarian operations in East Africa and as well in the Middle East. And after his service in the Army, he went back to school. He earned a Master's of Divinity and a Master's of Public Policy degree with a focus on international development. So after that graduation, he spent a couple years in Moldova through the Peace Corps. And then when the full-scale invasion in Ukraine happened, he wanted to put all of this experience that he had through conflict zones, his experience in Eastern Europe, and his education to help people that were suffering from the effects of that war and or the war that is still happening. And so he joined CWS as the team leader for both Moldova and Ukraine. And so he's been with Church World Service since June of 2022. So thank you, Andrew, for being with us today.
Thank you. Thank you.
So to kick us off, before Andrew actually starts sharing it, we wanted to just launch a little poll to help all of you be part of this conversation. So Heather, if you can launch the first poll, and we're wondering, what do you think is a daily challenge which daily challenge do you think is the hardest for families right now in Moldova and Ukraine? And you can select an answer. I think I see it different, don't I, than Heather? Do I see the poll different than everyone else? You can select the answer. It's access to food, safe housing. Is there an answer showing up? Someone write in the chat box. Yes.
Yes, there are
Okay,
answers.
thank you.
Yes.
Okay, thanks. Thanks, Mary Catherine. So just take a minute to do that. Heather, you can see like when it's mostly complete.
Yep. I'll end it.
And then are you able to launch it? It's weird on this end. Ah, okay, I can see it. Awesome. So can you see that as well, Andrew? So you can just see what people's responses are. This is great to see what different things that we're seeing that might be challenges for people right now in Ukraine and Moldova. And so, Andrew, seeing this list and through your work, can you paint a picture for us about what daily life right now looks like for families in Ukraine and Moldova?
Yes, I guess first of all, you're all right. All of these are problems that folks are dealing with. Oh, just disappears. I can't see anymore, but that's okay. Um, so uh, so in Ukraine and Moldova, of course, things are a bit different. In Moldova, thankfully, we're seeing that there are, at least a certain number of the folks who have resettled in Moldova have settled into a new rhythm of life and are doing all right. Others much less so. Because of the military conscription in Ukraine, one of the most obvious things about the families in Moldova is that there are very few men. It's almost all women with children and often elderly relatives. And so, because husbands, brothers, any men basically between the ages of 18 and 60 aren't allowed to leave. And so, you have folks who, you're trying to take care of your kids, you're trying to take care of your elderly mother-in-law who has, any of the issues that any of our elderly family members have, and then also trying to find a job, trying to find a place to live. It's all very complicated. Some people have done okay. Some people are still having a very hard time. Um, Things are expensive. One of the things that's difficult both across Moldova and Ukraine is the cost of energy and heating have gone through the roof. Like Aaron said, I spent a couple of years here in Moldova with the Peace Corps. Uh, I won't bother you with all of the exact numbers in local currency, but the cost for gas heating between when I lived here in 2018 and 2020, and the cost of gas heating after the first year of the war had increased by a factor of seven. So if you can imagine your heating bill being multiplied by seven, causes problems when you have limited income and you're trying to find a job. Um, and then on the Ukrainian side of things, you add to all of this the ongoing war. And there were degrees of this, right? Some people live closer to the front lines. Here, where CWS works in Odessa, we are not on the front line, but we are not so far away, and so we have air raids most days. And you can imagine that can wear on people. I mean, there's the obvious danger of it, but people have adapted. There are bomb shelters, but just if you get to the third time in a day and that siren goes off, and you're just like, I'm trying to live my life here, and we're dealing with that. I will say one thing that's great is the last couple of weeks we've turned the corner towards spring weather. This last winter was by far the coldest winter since the full-scale invasion began, which only makes all of the energy and heating costs all the more difficult. It makes it more difficult when the power is out, which was all the time during the winter. You'd be out for a day, 2 days, 3 days. So, no running water, no heat, causes problems. But in the middle of all that, I also have to say that people are extremely resilient and even funny, and the kindness that we see among Ukrainians in Ukraine and Moldovans and Ukrainians in Moldova is really inspiring. So, anyways, I can go on. That's probably an answer to one question.
Yeah, I love hearing your stories. That's great. Kind of still thinking about people. Do people still hope to be able to return home someday?
Sure. So, this has been a really big change. When I got here in the summer of 2022, so the full-scale invasion began at the end of February of 2022. I got here in June of 2022, to Moldova, I should say. Uh, and at the time, Ukrainian refugees, I should say, were still refusing to sign even 6-month leases because they kept saying, we're going to go home in a month, we're going to go home in a month, we're going to go home in a month. And 4 years have passed. And so, um, that makes things difficult. So people, Ukrainians in Moldova, both from kind of what we hear from when we talk to people directly, and then also there have been some polls about this, fall into roughly three even categories. About a third of people say, no matter what happens, I'm not going back. I'm staying here. They've created a new life for themselves in Moldova, and that's not always a bad thing. Sometimes it's great. There's a gal who works with one of our local partners, who is Ukrainian, came across as a refugee. Um, she had an aunt who lived in a particular place, and so she moved to that place. She really settled in. Like I said, she worked with our partner organization. She met a guy, they got married. She's about to have a baby. The beginning of that story is terrible that she had to leave her home, but she's created a good life for herself, and that's not a bad thing. So there's about a third of people who say that. There are about a third of people who say, um, as soon as the war ends, I'll go back. And then there are about another third of people who say, basically, it depends. And part of that depends on where they are from, because there are some parts of Ukraine that have been spared the worst of what's going on, such that when the war ends, you could more or less go home and things would be okay. There were other places that, yeah, I mean, there's no nice way to say this. They just don't exist anymore, right? There are communities that have just been burned to the ground. And so if you're from one of those places and you say, do you want to go home? Usually what people really mean is, do you want to go back to the country where you were born? Because they can't go back to what was their home. It doesn't exist anymore. And so they say, what resources will there be for us to move back? Do I move to some other part of Ukraine? Do I move to where I have some relatives? Will there be jobs back where I came from because the economy has been upended? So that's the picture for Moldova. Um, from Ukraine, one of the reasons why we work where we do in the Odessa Oblast is because so the Odessa Oblast borders Moldova, so part of it's just that it's right there, but it's become a big hub for people who are displaced from other places. So an oblast is it's like bigger than a county, smaller than a state. So the Odessa Oblast is 2 million people. Um, and out of 2 million people, something like 250,000 of them are people who are displaced from other parts of Ukraine, who wanted to stay in Ukraine, um, but couldn't stay where they were. Um, and when you talk to those folks, you hear a lot of the same things that you hear talking to folks in Moldova, except that there's no international border involved. Some of them say, hey, I found a new life for myself here in Odessa. We like Odessa. Others who say, yes, if the war ends, I'll go back to where I came from. Others say, it depends. So,
Hmm. Yeah. Yeah. So kind of a varied response based on people's experience. And yeah, thank you for sharing that. You may have covered some of this, but also, what does long-term displacement look like kind of 4 years into this crisis? What does that look like for someone?
yeah, I think it varies a lot. So I mean, just a little bit about Moldova receiving Ukrainians, I suppose. So Moldova is one of the poorest countries in Europe. It's a small country, only about 2.5 million people, and over 100,000 Ukrainian refugees live in Moldova. So it's like 1 in 25 people in Moldova is from Ukraine, which is a sort of crazy proportion compared to um, and there are other countries that have accepted, in raw numbers, they've accepted more people, but these are like much larger countries like Poland and Germany. And so Moldova proportionally has accepted more Ukrainians than anyone else. And they've been just wonderfully, wonderfully welcoming. In the early days, um, when, there was kind of nowhere for people to go, tens of thousands of Moldovans just took Ukrainian refugees into their homes. I mean, it was at one point it was I think 25,000 Ukrainians who were just living in private homes. People who just said, "Hey, we've got a room, come stay with us."
Yeah.
Beautiful, beautiful kindness. Um, Over time, some people have moved on to sort of more like Western European countries. Frankly, I know less about that. But for the people who have stayed in Moldova, um, a lot of people have been able to find some stability. For other people, it's been more difficult. Um, yeah, one of the big shifts has been people enrolling in the Moldovan uh, education system. So for the first year or two, it was only like 5% of refugee kids who were enrolled in local schools. They kept going online to Ukrainian schools. And part of that, again, was connected to this idea early on that we're going to be home soon. We'd rather not disrupt
Mhm.
things. But over time, a much larger number of people have enrolled in local schools. People have found jobs, but there are also difficulties around, um, if you have some sort of professional qualification, it doesn't necessarily transfer, right? So that causes problems for people. Um, yeah, what does long-term displacement look like? Yeah, different things for different people. I'm sorry, I don't know. I don't
That's
know how to
okay.
get into
Yeah.
this.
No,
Yeah.
that's helpful. And just one more question kind of on this long-term displacement and what are the greatest risks of displacement for people that as it becomes more prolonged? What is some of the greatest risks? Is it like housing, food, power? Is there something else like powers and energy power? Like, yeah.
Yeah. Yeah. I mean, all of those things for sure. Um, yeah, yeah. There are just difficulties with every stage of life. So like I said, Moldova was not a rich country to start with, had been dealing with shortages of school teachers before you had the addition of tens of thousands of Ukrainian kids. And so you're trying to uh, enroll your kids in school. Also, sort of like early childcare programs were absolutely overwhelmed. Um, you're trying to find housing that is safe, renting from people that you don't know. Like I said, there are many people who took people in, which is great. Other people who are just kind of trying to go out and, uh, yeah, find a place to live in a country they've never been to before. Trying to find dignified work, where you'll be treated properly and make a decent wage. Um, there's, like I said, the cost of everything is very difficult.
Mm,
Um, there, yeah, yeah,
okay. Yeah. So you've really done a nice job of painting kind of the picture, covering like when we asked people what they felt the challenges were, that access to food, safe housing, heat and electricity, so many of those things. So now want us to move a bit into how is Church World Service responding? So Heather we had a poll difficulty. So Heather, instead of launching a poll, we're going to put the poll question into the chat so you guys all can see that. So the question is, which of these, so hopefully she's listing those, which of these do you think is part of Church World Services response in Ukraine and Moldova? I know it's maybe a little long to type, but you all can still type just so you can let us know. But cash or voucher assistance, shelter and winterization, psychosocial support, protection services, and support to host communities. So if you want to take a moment, put what you feel might be. um, I'm seeing a lot of the alls.
yeah. Some of you have read our reports, yeah.
That's right. That's right. I think you might know Church World Service a bit. That's great. Thank you all for looking at that. So, Andrew, seeing that, and can you share first, as you talk about our programs, who are the primary populations Church World Service is supporting right now? And then what services are we providing Ukraine and Moldova today?
Yeah. So this is it has shifted over time. When we first started in Moldova, a lot of the work was just around basic needs, right? Um, a lot of groceries, a lot of personal hygiene and home cleaning kits, a lot of getting in to see doctors, a lot of assistance with children's education, a lot of trying to help find people places to live, um, access to psychologists, because of course this whole experience is extremely traumatic. Um, and then as time has gone on, there are still definitely people who are in need of those sort of basic needs. And then there are other people who are more in need of your sort of like longer term things around, trying to find employment or things like that. Um, so, right, yes. In Moldova now, we've shifted a lot from like very broad-based basic needs support to sort of more targeted uh, support. So we've helped one of our local partners develop a case management system where um, like I said, there's a huge need for initially people just coming in and saying like, here's a week's worth of groceries, which is really key when you don't have a new job and you've been run out of your home. Um, and we were very glad to be able to do that sort of thing. Now, things become a little bit more complicated. A person might need to see a lawyer to figure out their documentation. They might need more targeted support with trying to access the local medical system, things like that. I think the case management piece in Moldova has been very key lately. Also, we work with both we've worked for some years now in Moldova with Roma people or Romani who are discriminated against all across Europe. It's an unfortunate reality. And then when you combine that with all the difficulty of being a refugee, things become quite difficult. Um, and so we've done a lot of work trying to support Roma people to access the same rights and services that other refugees have. Um, there's been a lot of work on trying to help people access medical services. That's been a difficulty. I mentioned earlier about the shortage of teachers and the strain on the educational system. Moldova also has a very serious shortage of primary care physicians. In the way that the medical system here works, you can't get a referral to anybody else unless you have a primary care physician. In theory, of course, well, not of course, this is a very good thing. In theory, the Moldovan government has said that Ukrainians are allowed to access this system to work through primary care physicians, but then they show up at someone's door and they say, sorry, we're full. They go to another one, they say, sorry, we're full. And then, so if you can't access that person, then you can't get to anything else you need. And so we've worked with local partners um, to do a combination of things. One is just to advocate with local doctors saying the people do have the right to access these services. And then also to provide access to doctors who are paid through our partners when there really is just nowhere for someone to go. Um, we've done a lot of really great work also, I think, trying to help people integrate into their local communities, get to know their new neighbors, try to just reestablish the sort of social bonds that we all need to live a happy and healthy life. Um, we so we've been doing this work in Moldova, like I said, since 2022. My boss, Steve Weaver, who some of you have either met or heard from, was here like 2 weeks after everything started, trying to set some things up. And then I started in June. And then we registered legally in Ukraine in the summer of 2024 and kicked off our first projects there in September, here, I should say, in September of 2024. And so by the time we entered Ukraine, there were already a lot of other groups doing a lot of good work. And so we were trying to kind of ask the question, what are the needs not being met that we are equipped to meet? And what we wound up seeing was that there were a few kind of categories of very vulnerable people who were not getting services. So one of those things was people living in rural areas. A lot of the assistance was focused in the city. One of those things was a lot of elderly people, which also winds up having a weird correlation with people living in rural areas because uh, you have a lot of elderly people who are what we call internally displaced persons, IDPs, which basically means a refugee, except that you have not crossed an international border. So these people who have left some other part of Ukraine where the war is more intense and have settled in Odessa. But the pensions that people live on just simply don't allow them to pay for housing in the city. And so what they do is they go to the villages, they speak to the sort of local officials, and in most villages in Ukraine, because of other people who have left, they were just abandoned houses. And so they say, you can live here, which is, a lot better than not having a place to live. But often, these places are in sort of poor repair. Um, and then, so aside from rural, elderly, and then I mentioned Roma. We're also working with Roma people here in Ukraine, facing a lot of the same sorts of issues that Roma people are facing in Moldova and frankly other parts of Europe. And then working with women from very vulnerable categories of people. So we work with an organization that was founded to support women who have HIV or AIDS. And then they've expanded to also support sex workers and women with substance abuse disorders, and then their children. And so those were groups that they've been working with for many years who are vulnerable under the best of circumstances. And then when you belong to one of those highly marginalized groups and you also have been displaced from where you came from without a lot of social resources, people get in a very tough situation. So uh, that's one of the other kind of major groups of folks we're working with in Ukraine.
Thank you. And I mean, I think this correlates to, the types of groups that we're working with, the most vulnerable that are being overlooked. But how do you decide where help goes when help is needed everywhere.
Yeah. It's a very good question. And if any of you have a better answer, send me an email. 'Cause we're always trying, yeah, to figure that out. When there is far more need than we can meet, how do we try and figure that out? Um, like I said, a big part of it was just trying to see what needs were not being met from somewhere else. So for example, with elderly people living in the villages, um, we send out a mobile team that delivers basically like 2 months supplies of food and hygiene and cleaning items, and then offers them consultations with a nurse or a psychologist. And we work with the local social workers in each village to figure out kind of who are the most in need. And like I said, there's a lot of need, but so we look for um, folks who have different disabilities, folks who have sort of below a certain level of income. So a lot of elderly people in Ukraine are living on pensions of something like $100 a month, which is just not enough. So I mean, when I was talking about housing, so for my apartment, my wife and I, we pay $450 a month for an apartment in Odessa, which in the US would cost far more than that. And so it's like, for me, that's a great deal. But if you only have $100 a month, you can't pay $400 a month in rent. It's not possible. Um, and in the past, a lot of these folks were living, in community with their family, right? Like their kids, their grandkids, people they've known for a long time. But then, for the sake of their grandkids, their kids have left and gone to a place like Moldova, likewise a lot of their neighbors. And so, when you no longer have that social network to back you up, and you're really just left to rely on an insufficient pension, people are in a very tough situation. So we're looking for people who are living alone, people who have below a certain level of income, people who have disabilities, um, things like that. Similarly, with another project, I was talking about this organization working with highly vulnerable women. Most of them are actually referred from the HIV hospital here. And so it's folks who have been involved in their medical care, and then the hospital and the social service system does not have enough resources to support them. They refer them to our local partner. And that project provides people with vouchers, supermarket and pharmacy vouchers, so they can get food and other household needs, able to buy the medicine that they need to stay healthy. They can talk to a doctor, they can talk to a lawyer. And there's also just a lot of work on, I mean, the term we use is mental health and psychosocial support, but just like the things that you would normally enjoy in life, having people that you can get together with and do craft nights, and something for your kids to go, like take them to. Here in Odessa, we have is this an English word? Dolphinarium. It's like an aquarium with dolphins. And like they love that, it's like it seems like a small thing, but I mean, if you're a 10-year-old and half of your friends have left the country, and you can't go to school in person because your school doesn't have a bomb shelter that's up to certain specifications, and so you have to go to school online. And the soccer team you used to play on, the whole thing just got canceled. Even if you manage to stay safe, that's not how a 10-year-old's supposed to live their life, right? Like they're supposed to be able to go and play and do fun things and have friends, and so part of that program and some of the other things we've done in Moldova too, just provide, yeah, just provide that support to try and help people to have good things to look forward to as well. But
Yeah, I love that. As a parent of an 11-year-old that loves soccer, I really resonate
sure.
with that
Yeah.
sentiment, and absolutely helping kids just have some normalcy in a very unnormal situation. That's really beautiful. Thank you. So I love hearing that. What program are you most proud of implementing?
Oh man. That's uh, I mean there's so many good things. I have really, I guess that program I was just describing, I really appreciate the way that it touches a lot of areas of a person's life. So um so I mean, just one story, right? So there's a woman who now is part of that project that I was mentioning, who is a person who has HIV. And I'll just give her a name, it's not her real name. So common name here is Anya. We'll say Anya was worried that she also had cancer. And if you know anything about having HIV, the concept of also having cancer is just terrifying. And so she went to see an oncologist, and the oncologist was deeply unprofessional and mocked her and suggested she buy chainmail gloves to protect herself. Um, and so she just, she had no idea what to do. Um, Someone that she ran into referred her to our local partner, where she was able to talk to a professional doctor who respected her and was compassionate toward her and gave her medically appropriate advice, and was able to talk to a lawyer who then went back to this hospital and said, the way that your physician behaved is unethical and illegal, and it cannot continue with other patients. And she was able to receive voucher support for her basic needs for her and for her kid at a time when money was very tight. And then also find this community of other women and of other kids, for her kid to play with who understand what she's going through, who have similar life experiences. And so just to, it's so many things. And it's like each thing seems like a small thing, but it all adds up to, you know, a, a much better day than the one before.
Yeah, absolutely. And I think it really speaks to one of the things that I love about church world service programs is like, the overarching program might be addressing a medical need, but it, but it is like ripples off to so many other things, helping with food, helping with the psychosocial, that our programs aren't these siloed programs, but ones that really are looking holistically at the people that we serve. And that's a beautiful story. Thank you for sharing that, Andrew.
Yeah.
So I wanted to move because you've mentioned multiple times, that we work with our local partners, where the HIV hospital was getting a referral to our local partner. At Church World Service, we pride ourselves in our collaboration. That's our motto, is that we can always do more together than we could separate. And so could you tell us more about our key partners that we work with in Ukraine and Moldova?
Yeah, we have been blessed to work with some really outstanding folks who come from different backgrounds. So we do work with a couple of faith-based organizations. One of them is called Diakonia. That's in Moldova. They work with they're part of I should say, the Romanian Orthodox Church, and we worked with them to provide firewood in the winter over I think 3 different winters for people, like I said, dealing with all of these um, the cost of heating and electricity and everything else. We've also worked with them on an education center, helping families integrate locally. We've also worked with Caritas in Odessa. You may have heard of them. It's a Catholic organization in Ukraine. They're connected to the Greek Catholic Church, which is interesting. Also doing the firewood work, also supporting a shelter that they put together for elderly displaced people who just absolutely had nowhere else to go. Um, Another organization in Moldova called the Diamond Center is founded by a husband and wife. She's a teacher by training, he's an economist by training. She grew up in the Soviet orphanage system, which you may have heard was a really rather difficult place to be, and so had a strong passion for supporting other kids who had been through rough childhoods. They've been running the center for 20 years, and then when the full-scale invasion started, they also took in and worked with refugee kids. We also work with organizations that don't have a basis in faith, but have strong community roots. We work with an organization in Moldova that's been working on tuberculosis for 20 years, and then again opened their doors to Ukrainians when the conflict started. We have worked now with 3 different organizations led by Roma people, serving Roma people, and we've been really proud of that work. It's been one of the strange gaps where even a lot of the organizations or individuals who seem to be very well intentioned um, still discriminate. And so we've been very proud to support Roma people supporting their own community. And there are others, but I suppose that's a a sampling that I think represents our folks. Yeah.
Yeah, that really helps. Thank you. And so when we asked for questions, I think this speaks to our volunteers and the love and care that they had, that they not only wanted to know about our programs, but they also have concern for our staff. And so they have love for all of you as well. And so can you tell us more about the Church World Service team that's on the ground? And then how do staff stay safe while working in the midst of war?
Sure. So our team is currently five of us. Um, we have one who was in Moldova physically for the first about year and a half of the response. She is now based back in her home in upstate New York, and then she spends about 2 months a year in Moldova. In Moldova, we have one Ukrainian refugee and one Moldovan. Um, and then in Ukraine, it's just me and one colleague who is also Ukrainian. Um, so the two of us, I guess, especially because Moldova is quite safe. Come visit; it's a beautiful country. A lot of good things to see and do. But so in Ukraine, dealing with the sort of danger of it, it's just the two of us. Ilona is her name, my colleague. She's a medical doctor by training. Before working with CWS, she had worked with Doctors Without Borders and another organization called FHI 360. She's really quite excellent. And she is herself internally displaced. She had just gotten married right when the full-scale invasion kicked off, and her husband are supposed to move into a new apartment, their home together, uh, literally the week that the war started, and then were unsure whether they should do that and decided to move a bit further west to come back here to Odessa. Ilona had done her medical residency here in Odessa, so she knew the city and knew some people here. And the apartment that they were going to move into has been blown up twice in the years since. So they're very glad they didn't move in there. There is a lot of very real danger. Where we are in Odessa, yeah, like I said, I mean, unfortunately, there are air raids most days. Um, they, yeah, how do you say these things properly? It sounds weird to say, thankfully, most of the targets are infrastructure rather than people, because of course, destroying infrastructure also causes problems for people, but it does mean that there is a relatively lower number of people who are killed directly by the strikes. Um, we both where we live and she and I live in different neighborhoods, but and where we work, we have access to shelters. And so when the alarm goes off, we check. There's a messaging app here called Telegram. I guess I don't know if that's very big in the US or not, but there are Telegram channels that are run by um, basically by the Ukrainian Air Force, where you can go and look and see more information about what's actually going on because the alarm goes off for basically anything in the Odessa Oblast. So the Odessa Oblast is something like the size of Maryland. Um, so it could be there's something dangerous near me, or it could be there's something dangerous, 100 miles away. And so when the alarm goes off, we check the further news, the more specific news, and then decide either we're fine at somewhere else or we need to take shelter. So, um, and then we have things like GPS locators and medical kits. Like I said, I'm a former soldier and an EMT. Ilona is a doctor. We're fairly well equipped on emergency procedures. Yeah. Yeah.
Yeah, well, we still really appreciate your service in the midst of this really awful time right now. And I'm glad that you're safe and have safety plans. Um, One more question on kind of the safety component, and then we're going to move a little bit more to some stories. But are there areas you're unable to access due to safety issues, and or does that affect our response? I think in
Yeah.
this again in Ukraine.
Yeah. So there are areas we don't go to. There are um, there are other international NGOs that specialize more in that sort of right on the front line work. We don't do that. Um, that requires a lot of other uh, logistics for the contingency plans, things like that. There are folks working there, which is important. We aren't. And so like I said, we're in this sort of middle range where I don't know, what's that I'm estimating here, but we're maybe 100 miles from the actual front line. And so that means that there are no, there are no gunfights going on in Odessa, but we do have the air raids. And so we live in this sort of very weird middle space. I've adjusted to it. It was very strange for me at the beginning because I have the experience of being in a more direct war. Um, to live in something which is somehow halfway between that and peace it's a very strange existence. Because also just like most of the day, most folks are just going about their lives, right? Restaurants are open, people are going to work, people are going to school, they're you know, playing in the park, doing, walking their dogs, and then you have to take shelter. It's just a very sort of strange um, combination of things. Yeah, I don't know how to put that more elegantly, um, but so we do avoid the direct front line. I'm sorry, I'm trying to remember exactly your question, Aaron.
Yeah, I mean, are there areas we can't access, or does
Mhm.
it affect our response at all?
Yeah, well, I guess, and the other way that it affects our response is because in the last year or so, um, and largely because of the current U.S. administration, the amount of funding available to organizations doing this sort of response have shrunk tremendously. And so there have been decisions made by like the United Nations coordinating bodies here and some other people to really prioritize like the immediate frontline areas, which is not a crazy thing to do, right? And those are the people who are in the greatest of the greatest need, right? But unfortunately, what that's meant is that people who live in a place like where we are, who are still in very great need, have just been sort of abandoned by a lot of other organizations. And so what we've tried to do is to stay here, to keep trying to work with people. um, it's we get a report from the UN that in the Odessa Oblast, that there were something like 20 or 30,000 people were not getting food, all the food they need every day, especially in these village areas. So we try to support a few thousand of those people because otherwise there's literally at this point nobody else doing that.
Yeah,
Um, so
yeah. Okay, so I want to just shift a little bit. So the people that are part of this webinar today are our Crop Hunger Walk leaders and our walkers, the people that are raising funds and engaging their communities around the work of Church World Service. So can you
thank you.
share, yes, can you share a story of a family or a community whose life has been changed by Church World Service support?
Yeah, I mean there were so many. um, wow, wow, wow. One, yeah, I can tell a couple stories, I guess. So, one of the organizations we've been working with in Moldova since the beginning is actually one of the two organizations that CWS had worked with prior to the war. As I mentioned earlier, it's called Diaconia, the social service arm of the Romanian Orthodox Church. They have this center called the Anastasis Center, which means rebirth, um, or resurrection. Sorry, I should say. Um, and was originally founded largely to help with educational integration, but now has become sort of a social hub. Um, and so, like I said, trying to help people reestablish, things like neighborly relationships and social connections. And was there some time ago, was chatting with some folks. This woman was telling me her husband is not only stuck in Ukraine, he's stuck on the Russian side of the line. Um, and he was a veteran. He had served in the Ukrainian military before all of this started. Um, and the Russian soldiers have a nasty habit of trying to find those people and either hurt them or force them to join the Russian military. And so he took everything he had from his army days, his old uniforms, anything, and he took them out in the field and buried them. But is not able to cross over the line. His wife is in Moldova with their kids, and she says, we talk every day, but only on FaceTime. We never text because that way, if they were to take his phone and go through it, there would be no evidence of anything. Um, and she said that there's nothing anyone can do to fix that situation until all of this horribleness ends. But, but a couple times a week, I can come here. I can spend time with other women who are facing the same thing I'm facing. I can do a yoga class. My kid can run around and play with other kids. And, for a little bit of time, you can just feel like you're living a normal life. Um, yeah, oh goodness, there's so many things. Um, we I guess just an example of when we're taking things out to the rural areas. I was out with our partner doing deliveries a while ago during the winter, and we always go out with a local social worker, so there's always a friendly face, someone who the person already knows, and came to this woman's house, Ala, and um, we drove because we had this van because we're making deliveries, and she came out and she seemed upset, and then we found out what had happened was basically nobody ever comes to this particular part of this village in a car, and so she thought we were there to turn off her gas because she hadn't been able to pay the bill. And so we were able to say, first of all, we're not here to cut off your gas. What's even more, we have some stuff for you, and just like the relief is beautiful, but frankly painful. Because you don't, it's a terrible shame that she has to be living with that fear and trying to figure out how to get by. Um, yeah, yeah, I could tell more stories, but it's yeah, it really does matter to people. I promise you, all the money you raise, it really is affecting folks
Well,
in
that segues into
meaningful
my last
ways.
question. And I have to say, Andrew, I mean, you spoke with our staff a few weeks ago and you shared a story. And when you shared it the first time, I got teary-eyed. As you shared it again, and I just got teary-eyed. It's just really beautiful. So thank you for sharing those stories. It is inspiring to know that we can be there in solidarity with people really struggling right now. So that's really helpful. So segueing to one more question. Well, actually, I have two, but in this section, if you could tell every crop hunger walker one thing about what their walking means to families in Ukraine and Moldova, what would it be?
Yeah, I mean, it's just that it matters. Um, so yeah, I mean, yeah. About a year ago, when CWS was going through a lot of difficulty with the new administration and all of these other organizations, trying to figure out whether we were going to be able to continue services. And there were a lot of things that just vanished overnight. Services that people needed that just went up in smoke. And as I mean, because it was every day we were finding out new worse things about how things are going to be going. And then we were going to be organizing meetings with our local partners to talk about the reality and the future and everything else. And very shortly, but before actually we could have those meetings, I ran into the woman who runs one of the organizations we work with, and she came up to me and she said, like, can we keep working? And I said yes. I said, you know, thank God, because so much of the money that we're working with is just coming from people and churches and not from the government. Not that there's anything wrong with using government money to do good, but because that disappeared. But I was able to say because the people who support us are just normal folks and churches, yeah, we get to keep working. And I'm so grateful for that. And so I'm grateful to all of you. Um,
Thank you, Andrew. Thank you, and I am grateful for all of you too, and the hard work you do. So I have one final question, but before that, I did want to see. I don't see anything yet, but are there any if there are any questions that someone has that didn't get answered today, or that Andrew said something and you wanted just a little more information, you can type that in, although we are getting low on time, but I just wanted to give a moment for that. And before I ask the last question, Andrew, I do just want to thank you again for joining us today and sharing with us more about our work there. Thank you for your service. Thank you for representing the people that we serve so beautifully. I really appreciate that. And just so you all know, with the time change, it's almost 10 o'clock for Andrew. So also just thank you for staying
Yeah,
with
sure, sure.
us tonight for you. Okay, I don't see, Heather, I'm not missing any questions, right? Right? I'm good. Okay, well, I'm going to move on then. If somebody does have a question, you can ask it and we can always follow up with you later too. But so, Andrew, to conclude our time together, what gives you the most hope as you look towards the next year?
Yeah, it's a good question. I guess one of the things that maybe I should mention earlier, talking about daily life. Um, it's just 4 years of war is a really long time, and people are getting tired, and I would be lying if I said anything else. Um, but uh, but people are people are tough, man. I was the apartment building that my wife and I live in. There's a woman who works sort of at the front desk, and I was down in the lobby the other day because I was waiting for a delivery, and just kind of asking her how things were going, just try a normal greeting. Wasn't trying to start any discussions. And she said, "Well, how can I be in this city that is bombed every day? But this is where I was born, and this is where I will die because we Ukrainian women, we are strong." I was like, "Yes, you are," you know. And so just to see somebody, uh, you know, who clearly do have hope, even though it's been a long go. And all the people all the Moldovans who have just, opened their hearts and their homes and their wallets, even if they didn't have a lot of resources to start with, to support Ukrainians, and to see the way that other Ukrainians support, folks displaced from other places. There's Yeah, I mean, there's a lot of darkness in the world, but it's so good to see folks trying to do what they can, and I suppose that's all we can do. But people are doing it, which does give me hope. So,
That's wonderful. Thank you so much. And thank you for sharing that hope with us. And everyone that's participating, share these stories with your community to help our communities raise more funds so we can support our programs around the world and in Ukraine and Moldova. So thank you all. It's good to see you all today.